What can behavior analysis learn from Adversives Controversy by J.M. Johnston? Before we dive into the article, I would like to show a brief video by Amethyst Shabner. She is an individual identified with an autism spectrum disorder, and she promotes autism awareness videos and reports much of the history she's experienced with applied behavior analysis.
I want a renaissance to shine a light, be the change we want, set things right. We've been waiting in the dark for so long.
ABA stands for Applied Behavioral Analysis. Currently, it is the go-to method for treating autism and is strongly encouraged from a very young age to teach autistic children socially acceptable behaviors and to help parents to stop or prevent behaviors that they don't particularly enjoy. The idea behind behavioral analysis is to take your subject and first you analyze what is prompting the behavior that you don't like. So say for an autistic child that would be hand flapping. And then the second step is to develop consequential strategies to prevent that behavior from occurring. So the idea is observe and then come up with analytical and scientific strategies to make sure that behavior doesn't happen anymore. How you make sure that that behavior doesn't happen anymore, say hand flapping in an autistic child, is dependent upon the concept of operant conditioning. The operant being the autistic child, and conditioning being the use of reinforcement and punishment. I am strongly against the use of ABA therapy to treat autistic children. The idea behind ABA, the very core concept, is using the analysis of behavior, and you apply that analysis systematically to improve socially significant behavior. Some ABA therapists will say, well, you know, everybody has consequences to their actions. There are positive outcomes and negative outcomes. You can study hard for that test and pass, or you cannot study and fail. And those are behaviors and choices that you have to make. Now, the real problem that occurs when you try to treat autistic children with ABA therapy is, you know, what is socially significant behavior and who gets to say what is socially acceptable or not. The idea that autism needs treating at all is I think, inaccurate. The use of operant conditioning on children, especially on autistic children, is, to me, sickening, because autistic children don't need to be conditioned. There are some things that autistic children do need help with. There are many comorbid conditions that occur alongside autism, such as dyspraxia, sensory processing disorder, social anxiety, insomnia, speech impairments. All of these things do need help and treatment, but what doesn't need treatment is autistic behaviors. And that's entirely what ABA is about. It's right in the name, Applied Behavioral Analysis. ABA is all.
The field of applied behavior analysis is a fairly new discipline. As a matter of fact, in the early 1950s and 60s, the focus was slowly turning away from studying animal behavior in labs towards studying human behavior. This study, known as behavioralism, focused to understand and document respondent conditioning, and therefore the results were not applied or socially valid. Unfortunately, the populations selected as test subjects typically were disenfranchised with no to little voice or legal protection. At that time, constitutional rights of individuals suffering from mental illness or an intellectual disabilities were not considered, and behavioralists were given a free rein to test and develop technology, the behavior technology, with almost no oversight. And it is from this tainted foundation that the field of applied behavior analysis took root. Decades after its inception, what has been termed Adversives Controversy still blankets the field of applied behavior analysis. In this context, Adversives Controversy is defined as a collection of disagreements among a variety of interested parties concerning the techniques used to decrease undesirable behavior, mainly with individuals with developmental disabilities. These disagreements focus on the systematic usage of adversive stimuli as the prescribed consequence in behavior modification protocols. One dissenting perspective argues that some, if not all, adversives should be removed as consequent options, especially with the numerous non-aversive substitutes that are available. Johnston primarily discusses individuals with developmental disabilities as the target population for his paper. This was one of the original populations behavior analysts addressed early on, but it is now more commonly known as the gold star standard for autism spectrum disorders. The conclusion drawn by Johnston was that the improvements to the delivery of behavior technology could enhance the field by addressing the domains of research, training, and politics, as well as how these domains could impact new behavior analysts that are currently being educated. So let's take a moment to briefly examine how new analyst training would look within the scope of the domains that were suggested by Johnston. In the area of research, Johnston believes that the field has shortcomings in researching behavioral characteristics such as pathologies for the population they serve. Furthermore, he believes that the research primarily focuses on demonstrating the effectiveness of treatment procedures. So in the context of training new behavior analysts, they would receive instruction on implementing a more rounded scope of behavior analysis. And this research would emphasize things such as developing new techniques for merging culturally informed consequences and target behaviors. My perspective related to Johnston's position is that I agree with him completely, and that I feel that it is critical that new behavior analysts are encouraged to research more positive reinforcement strategies. In the area of professional education, Johnston believes that the professionals who represent the field carry some of the burden for the Aversives Controversy, and at the time of the publication, Johnston states that there were no minimum recommended standards for what defined an adequate master's or doctoral training program. So in the context of training new behavior analysts, fortunately this is not still the case, and we have certification boards that work to establish uniformity in ethics, licensure requirements, and research dissemination. My perspective related to Johnston's position is that I agree with him 100%, and although the field is making steps towards addressing the problem of adversives, it is still widely used, and it is disproportionately used on minority groups. However, fortunately, individuals like Amethyst who were raised receiving adversives now have voices and platforms to express their experiences on. In the area of politics, Johnston states that at the time of the article, behavior analysts were minimally represented in the arena of politics, and this was due in part to their isolation from other professionals who service the same populations. So in the context of training new behavior analysts, Johnston believes that new behavior analysts should be encouraged to actively participate in associations and special interest groups geared towards the populations that they serve. He also feels that new analysts should publish in a variety of different types of journals, and lastly, they should be encouraged to pursue careers in administration to the same extent that they select careers in research and service delivery. My perspective is that I agree with Johnston. However, I feel there is a huge need for analysts who do not use adversives to partner with advocacy groups and individuals like Amethyst who are now using their voice to make change in the system. This article was written prior to the new ethics codes for behavior analysts, which will become effective January the 1st of 2022. The new codes address all of Johnston's concerns and are actually more comprehensive in protecting the rights of clients and stakeholders. They also establish more guidance in conducting and disseminating peer-reviewed research. The new codes have 4 foundations, and the ones that apply to this article are: the first one, benefit to others; the second one, treat others with compassion, dignity, and respect. And the fourth one, ensure their competence.